This is Jennifer Chase, and I'm going to present to you Project 2. The first thing I am going to present is Deliverable 1, the business case. If the receiving provider does not follow up on referrals, patients can get sicker and require more care. The patient may instead choose to receive follow-up at another health system. This is why it's really important that um, medical offices within the same health system keep track of their referrals to try to increase revenue and increase the number of appointments that are actually made based on the referral. And then once we make the referrals, a computer system that I'm going to show you can also generate efficient reports, and it can also be used to document information about the referrals. It would pay for itself through the additional revenue through increased numbers of patients. Referrals really are an important part of medical care. Some insurance companies require a referral to a specialty from a primary care provider before they will pay for such a referral. Other times, it's the physicians themselves that require a referral because they have a limited amount of time and don't want to see a patient from a brain tumor when in reality their headaches could be caused by something simple as taking too many birth control pills. The purpose of the project would be to develop an easy-to-use and efficient method of tracking patient referrals. Then you can make reports that would list how many patients have not made an appointment and need to be contacted. It's really important to follow up on patients who have gotten a referral because they may not have made their appointment yet, and we want them to make appointments at the medical offices in our facility. Um, and the program is really important to use also because you can send types of information such as patient identifiers, like name, date of birth, contact information, and it also is going to include the provider's names and the reason for their referral. There are some risks and issues with this project. First, the cost. It will cost money to create a database that is capable of producing reports. However, we feel that the costs will more than be made up for with increased revenue through patients following up and making appointments. Also, it's possible to circumvent the system and just to continue to do what they've been doing before. That's why it's impossible that all stakeholders have buy-in and we do the change process with this project. Also, it's important to ensure that HIPAA is being protected and this product would be on an encryptable system, unlike just writing it down on a piece of paper like some places do. Reports generated by our database referral system are really important. They can be used to keep track of referrals in one area. It can be difficult for a busy office to do this. Some are just, penciling in that they sent a referral in like a calendar. Some are just handwriting their referrals and giving them to the patient. and then the receiving provider doesn't always know that they have a referral. This is really important in a case like, say, a patient has a mole on their head and the general practitioner refers them to a dermatologist. That dermatologist sees them, thinks that they possibly have skin cancer, they need this excised in the OR, so they'll refer them to a general surgeon. If the patient does not make all these appointments, they could possibly pass away from lack of care, so it's important that the doctors are aware that a referral has been made. Conceptual data. A referral system can be made into a conceptual data model and illustrated in an entity relationship diagram. I wasn't able to cut and paste that, however, I will send that separately. The needed entities include the patient, the doctor, clinic, and the referral. And for example, a patient can have one or more doctors, referrals, and clinics. A doctor has one clinic, many patients, and can write many referrals. A clinic can have one or many doctors, many patients, and they can receive many referrals. Sometimes a clinic receives the referral in general, like maybe a diabetes clinic will receive a referral and not a particular doctor. And each referral, of course, can apply to one patient, several doctors and clinics, and one or more referral reasons. We're going to make some assumptions with this product. When making this model, I'm assuming all referrals would go to offices in the same health system. For example, many hospitals have large office buildings attached to them with a variety of specialties, and some of these physicians may also see patients that are hospitalized and perform surgery there. Other providers will only see patients in their office, and I would assume that this is the case for the model I am creating. The model would not work if both the sending and receiving provider were not using the same referral system. In that case, calling and faxing or ignoring that the patient has a referral, like sometimes is the case, would be the alternative. This is a list of my entities and attributes. My four entities are patient, doctor, clinic, and referral. And I did doctor and clinic separate because the clinic's the physical place, and the doctor is the provider. And not all referrals would be sent to a particular doctor. Some would be sent to the clinic in general, because some clinics contain multiple providers. Access is not available on Mac, so I did some mock databases and reports. I wasn't able to get my access information over to this Mac for this presentation. Here is an example of referrals that could be sent by a primary care provider. As you can see, we have patient name, patient ID, date of birth, patient address, telephone number, and also the name of the clinic, the doctor's name, the doctor's address, a doctor's phone number, and as you can see, they're all in the same medical building or same organization. And then we also have the reason for the referral and the date it was made. And then with the system, you'd be able to extract reports from that and list, all the patients referred to on a certain day and by a certain condition and by a certain provider, things like that. And I'll be showing you a little more about that in a few minutes. This is an example of some referrals that might be received by an orthopedist. as you can see, a variety of doctors are sending their patients to an orthopedist, and it would say the reasons for the referral. As you could see, neurology might send patients, primary care, oncology. Sometimes, hip pain can be caused by cancer. Like if there's a lesion, they might need to see an orthopedist and receive maybe a hip replacement or injections. So all these patients would need to make an appointment if they would like with this orthopedist. A lot of meaningful data could be extracted from the referral databases. Um, One could find all the patients who are referred by diagnosis in a selected date range or by a particular provider, for example, and list them. As much or as little identifying information could be extracted for the report. Sometimes you may just want to search for patients' names because you forgot their name. Um, or you may want all their contact information so you can follow up with them with a letter. And it's important that all these reports have consistent information. The patient's name needs to match up all the time with their correct contact info, reason for referral, etc. And that's a reason why doing this database is really important, so we don't have to continually enter in that information. The database could send this to different reports for us. This is an example of a report that you may generate if you wanted to list out patients by their diagnosis that have active referrals. Say you only wanted their name. And these are all of our patients that have hip pain, as you can see. This is a list of patients by diagnosis with active referrals, and it shows all of their contact information, um, if that were necessary based on what kind of report we were creating and why. And this way, you could contact all of your patients and make sure that they've made an appointment with your organization. This would be a list of patients who have not yet made the appointment. And this is how it would look if a report was made and you wanted to find out all of your patients that were listed by a particular doctor. I just made up this name. These are all of our patients who were referred to us by Dr. Sullivan. That way, we could send Dr. Sullivan a letter thanking him for referring patients to us if we would like. Here are a list of my references that I used for the business case.